The chapter on cardiovascular disease and lipids really brings us up to date in terms of the recently published cholesterol guideline by the American College of Cardiology and the American Heart Association, in addition to the assessment and management of hypertriglyceridemia and to some extent low levels of HDL cholesterol. The guideline that's been recently updated on cholesterol really deals with endocrine and metabolic diseases in a major way, and that two of the guidelines relate to patients with diabetes, and the other two relate to people with existing cardiovascular disease, with or without diabetes, or very high levels of LDL cholesterol. Now, the guideline's very evidence-based, and the chapter is going to reflect on that evidence without the detail you're going to see in the publications that really present the guideline. But we're going to make this kind of user-friendly for the endocrine audience so that they can actually understand the guideline and how it applies to the assessment and management with patients with lipid disorders. Now, triglycerides and HDL cholesterol were not covered by the guideline because these are areas where there remains a fair degree of uncertainty in terms of what physicians should do to assess and manage these patients. But our chapter really will delve into where that evidence exists, make recommendations for adequate assessment of patients with high triglycerides and or low HDL cholesterol, and go forward to bring forth the argument that some of these patients should be treated and some should not be treated with existing lifestyle modifications and pharmacotherapy. And the final thing I think we'll cover is really an evolving science that relates to levels of lipoprotein small a. This is a very atherogenic lipoprotein wherein currently we use it to assess risk, but in fact we have no specific therapies. But good news is those therapies are forthcoming in the next decade, and we'll outline when a physician should actually be assessing lipoprotein small a and how that might influence their decision-making process in the clinic.